Hi, I'm Hannah Tulkoff. I'm one of the nurse practitioners at Ob-Gyn Associates, a division of Advantia Health. I currently work at the Silver Spring and the Beltsville locations. Today I'm going to be talking to you about when to schedule your first GYN visit. So typically we recommend this starts at age 13 to 15. Typically the first visit just consists of a conversation with your provider. This is to learn a little bit more about your health history, prior surgeries, current medications, and most importantly, concerns regarding your menstrual cycle and sexual activity. Now, the key to this visit is going to be to providing honest answers, and that's going to help us ensure we are providing the best safe medical care for you. Much of the information you do tell your provider will also be kept confidential. If an exam is warranted, the most common exams we might do include a physical exam and an external genital exam. You don't necessarily need an internal pelvic exam unless you express concerns about abnormal bleeding, pain, or discharge. If you're sexually active, we'll always offer you sexually transmitted disease screening. This can be performed by vaginal culture or urine sample, but it also does include a lab serology sample portion as well. So prior to any exam, a chaperone will always be offered to you. This can be either a parent or guardian or one of our medical assistants. Now, there's two parts to a gynecologic exam. The external exam is consisting of the provider looking at the vulva, whereas the pelvic exam consists of looking at the vulva, the vagina, the cervix, and checking the internal organs. So the pelvic exam, a provider will place 1 or 2 gloved lubricated fingers inside the vagina and up into the cervix. The other hand will press on the abdomen from the outside, checking for areas of tenderness, pain, or any masses. Now, you've probably likely heard about a pap smear. So this test is not recommended before the age of 21, regardless of sexual activity. But a pap is vital for checking for cervical cancer screening. And essentially, we're looking at your cervix for changes to the cells, and in which case we will then reflex the pap smear to look for something called HPV, human papillomavirus. Now, again, this doesn't start until age 21, but that doesn't mean that we shouldn't see you sooner. There are plenty of other reasons and plenty of other things that your provider can help to assess and to address. Hopefully this answers some of your questions. We look forward to seeing you in the future.